Welcome back to the Healing Your DID course. Thank you for becoming a member to get access to this course. In today's topic, we're going to be talking about the conventional way DID is handled. So the first thing is that is there any treatment for DID? No, there is not. There is no treatment specifically for DID. There is no medication specifically for DID. Unlike things such as depression, anxiety, trauma, those sorts of things, there is no medication that's going to treat dissociation. It's going to treat other symptoms, because symptoms is what is treated often. And a lot of times these medications, they often mask the symptoms. They don't actually address the root cause of the depression, of the anxiety, or of the trauma. So you can take these medications and they may help you, but the thing is, it's not going to tackle the root cause of the issue. So if you have PTSD, if you have trauma and flashbacks, it may help you deal with some of the symptoms better, but it's not going to cure you. It's not going to get rid of the trauma that happened to you. You have to be able to come to terms with that on your own. You may still be triggered. You may still be very upset and think about it day in and day out, but it's about you learning not to take it so personally and to be reactive about it. Therapy is also another major thing when it comes to a DID treatment. It can help with some issues. If you're going to a therapist, talking with someone else can help you deal with a lot of issues that you have. But the unfortunate truth is that the disorder is often missed and left untreated. And this is because it is so difficult to actually be able to have the therapist actually see this disorder. Not only do a lot of therapists not actually consider this disorder to be real, because it is a very complex one, but they may not see dissociation. They may see all the other symptoms, such as depression and anxiety, PTSD, but they may not see the dissociation. And that's often because dissociation is very hidden. It's hidden from the therapist because it is a coping mechanism. In addition, it is also hidden from the person who has the disorder. Therapists may not be aware of trauma due to the amnesia barrier. So as we talked about before, if a certain personality goes into therapy, that personality is only going to share what they know. They're not going to share what they don't know about these other personalities, and because of the amnesia barrier. Now, it is very possible that this personality may know something regarding the trauma that happened, but the way that it will talk to the therapist will be like, this person dealt with this trauma. I didn't deal with that. Basically talking about this other personality that they have has dealt with the trauma, but they haven't dealt with it. And while that is very true, it also causes some issues where maybe the therapist may not actually take the person seriously, because it's like, how can someone be serious saying that it happened to someone else, but that person is them as well. It's just within their same body. So this is a very complex thing, and a lot of therapists may not really understand it or know how to really treat it. So in the next topic, we're going to talk about alternative ways of handling DID, things that may not be part of the mainstream, that may need to be looked at from a different perspective.